Have you ever wondered why some health problems become more common for women after the age of 50? Turning 50 is not the end of being healthy, active, or independent. In fact, many women continue to live strong and fulfilling lives well beyond this age. However, this stage of life also brings important changes inside the body that should not be ignored. Hormonal changes, especially after menopause, along with natural aging, lifestyle factors, and genetics, can increase the risk of certain health conditions. The important thing to remember is that many serious health problems do not appear suddenly. Often, the body gives small warning signals before a condition becomes more serious. Recognizing these signs early can help women seek medical advice, start treatment sooner, and take better control of their health. In this video, we will discuss 10 health problems women over 50 should never ignore, including the warning signs, why these conditions become more common, and simple steps that can support healthier aging. Let's begin with one of the most important health concerns for women after 50. Heart disease. Many people still think heart disease mainly affects men, but this is a dangerous misconception. Heart disease is one of the leading health risks for women worldwide, especially as they get older. Before menopause, estrogen provides some protection to the heart and blood vessels. However, after menopause, estrogen levels decrease, and this can contribute to changes in cholesterol levels, blood vessels, and overall heart health. Other factors such as high blood pressure, diabetes, excess weight, smoking, lack of exercise, and unhealthy eating habits can further increase the risk. One challenge is that heart disease symptoms in women are not always obvious. Many women expect a heart problem to cause severe chest pain, but symptoms can sometimes be much more subtle. Warning signs may include unusual tiredness that does not improve with rest, shortness of breath during normal activities, pressure or discomfort in the chest, pain spreading to the arms, neck, jaw, or back, dizziness, nausea, or sudden sweating. Some women may feel like something is simply not right with their body, even without intense pain. These symptoms should not be ignored, especially if they appear suddenly or are different from what you normally experience. Protecting heart health after 50 starts with everyday choices. Regular physical activity helps strengthen the heart and improve circulation. Even simple activities like walking regularly can provide significant benefits. A heart-friendly diet that includes vegetables, fruits, whole grains, lean proteins, nuts, and healthy fats can support better cardiovascular health. Reducing highly processed foods, excessive salt, sugary drinks, and unhealthy fats can also lower risk factors. Regular health checks are extremely important. Monitoring blood pressure, cholesterol, and blood sugar levels can help identify problems before they become serious. Remember, heart disease is not an unavoidable part of aging. Many risk factors can be improved through awareness, lifestyle changes, and timely medical care. The second health problem women over 50 should never ignore is high blood pressure. High blood pressure, also known as hypertension, is often called the silent killer because many people have it without knowing. A woman may feel completely normal while high pressure is slowly damaging the blood vessels, heart, kidneys, and brain. After the age of 50, changes in blood vessels, hormonal changes, weight changes, and reduced activity levels can increase the risk of developing hypertension. One reason it is dangerous is that symptoms may not appear until blood pressure becomes very high or complications begin. Some possible warning signs include frequent headaches, dizziness, blurred vision, shortness of breath, chest discomfort, or unusual fatigue. However, many people have no symptoms at all, which is why regular blood pressure checks are so important. Over time, uncontrolled high blood pressure can increase the risk of heart attacks, strokes, kidney problems, and vision damage. The good news is that blood pressure can often be managed successfully. Reducing salt intake, staying physically active, maintaining a healthy weight, managing stress, getting enough sleep, and following medical advice can make a major difference. Women over 50 should make blood pressure monitoring a regular part of their healthcare routine because early detection provides the best opportunity to protect long-term health. Now let's look at another condition that can quietly weaken the body and often goes unnoticed until a serious problem occurs. The third health problem women over 50 should never ignore is osteoporosis. Osteoporosis is a condition that causes bones to become weaker, thinner, and more fragile over time. It is often called the silent disease because many people do not know they have it until they experience a fracture. After menopause, the risk of osteoporosis increases because estrogen levels naturally decrease. Estrogen plays an important role in maintaining bone strength, and when levels drop, bone loss can happen more quickly. Many women believe that weaker bones are simply a normal part of aging, but significant bone loss should not be considered unavoidable. There are many ways to protect bone health and reduce the risk of fractures. One of the biggest concerns with osteoporosis is that bones may become weak without causing any obvious symptoms. A woman may feel completely normal until a small fall or simple movement causes a fracture. Common areas affected include the hips, spine, and wrists. Some warning signs that may indicate bone loss include losing height over time, developing a more rounded posture, ongoing back pain, or fractures that happen more easily than expected. Several factors can increase the risk of osteoporosis. These include a family history of osteoporosis, low calcium intake, vitamin D deficiency, lack of physical activity, smoking, excessive alcohol consumption, and certain long-term medications. The good news is that bone health can be supported through daily habits. Calcium is essential for strong bones and can be found in foods such as dairy products, leafy green vegetables, almonds, and fortified foods. Vitamin D is also important because it helps the body absorb calcium properly. Safe sunlight exposure, certain foods, and supplements when recommended by a healthcare professional can help maintain healthy levels. Exercise is another powerful tool for protecting bones. Weight-bearing activities such as walking, climbing stairs, dancing, and strength training help maintain bone strength and improve balance, which can reduce the risk of falls. Women over 50 should also discuss bone density testing with their healthcare provider, especially if they have risk factors. Early detection allows women to take steps before serious fractures occur. Strong bones are not just about preventing fractures, they are about maintaining independence, mobility, and quality of life as you get older. The fourth health problem women over 50 should be aware of is type 2 diabetes. Type 2 diabetes is a condition where the body cannot properly use insulin, a hormone responsible for helping control blood sugar levels. The risk of developing diabetes increases with age because the body's ability to process glucose may become less efficient over time. Hormonal changes, reduced physical activity, weight gain, and genetics can also contribute. One of the biggest challenges with type 2 diabetes is that it often develops slowly. Many people do not realize they have high blood sugar until symptoms become more noticeable. Some common warning signs include increased thirst, frequent urination, constant tiredness, blurred vision, slow healing wounds, frequent infections, and unexplained changes in weight. Feeling exhausted even after getting enough sleep is something many women ignore, but persistent fatigue can sometimes be linked to blood sugar problems. If diabetes remains uncontrolled, it can gradually damage important parts of the body, including the heart, kidneys, eyes, and nerves. It can increase the risk of heart disease, kidney problems, vision loss, and nerve damage, which is why early awareness is so important. Fortunately, many cases of type 2 diabetes can be prevented or better controlled through healthy lifestyle choices. A balanced diet with vegetables, fruits, whole grains, lean proteins, and healthy fats can support better blood sugar control. Reducing sugary drinks, excessive processed foods, and refined carbohydrates can also help. Regular physical activity improves the way the body uses insulin. Even daily walking can provide significant health benefits. Maintaining a healthy weight, getting enough sleep, managing stress, and following recommended medical care can help protect against complications. Regular blood sugar testing becomes increasingly important after the age of 50, especially for women with risk factors such as family history, high blood pressure, or excess weight. Remember, diabetes is not just about sugar levels. It affects the entire body, and early action can protect your health for many years. Now let's move on to another important health concern where early detection can make a life-saving difference. The fifth health problem women over 50 should never ignore is breast cancer. Breast cancer is one of the most common cancers affecting women worldwide. Although it can happen at different ages, the risk generally increases as women get older, especially after the age of 50. The most important message about breast cancer is that early detection can make a major difference. When breast cancer is found at an earlier stage, treatment options are often more effective. Many women believe breast cancer always causes pain, but in reality, early breast cancer may not cause any pain at all. This is why paying attention to changes in your body and following recommended screenings is so important. One of the most common warning signs is a new lump or thickened area in the breast or underarm. Not every lump is cancer. Many breast changes are caused by non-cancerous conditions. However, any new or unusual lump should be checked by a healthcare professional. Other warning signs include changes in breast size or shape, changes in the appearance of the skin, redness, swelling, or skin that looks similar to the texture of an orange peel. Changes in the nipple should also be taken seriously. These may include a nipple turning inward, unusual discharge, especially bloody discharge, or persistent changes around the nipple area. Breast pain is not always a sign of cancer, but ongoing pain in one specific area that does not improve should be discussed with a doctor. Several factors can increase the risk of breast cancer. Age is one of the biggest risk factors. Family history, certain genetic factors, obesity after menopause, lack of physical activity, smoking, and excessive alcohol consumption may also influence risk. However, it is important to understand that many women who develop breast cancer do not have obvious risk factors. This is why awareness and regular screening are important for every woman. Mammograms and other screening methods recommended by healthcare professionals can help detect changes before they become more serious. Women should also become familiar with what is normal for their own bodies. This does not mean living in fear or constantly checking for problems. It simply means noticing changes and seeking advice when something feels different. A healthy lifestyle can also support overall breast health. Maintaining a healthy weight, staying physically active, eating a balanced diet, avoiding smoking, and limiting alcohol intake can all contribute to better long-term health. Remember, awareness is not about fear. It is about giving yourself the best chance to find problems early and take action. The sixth health problem women over 50 should never ignore is thyroid disorders. The thyroid is a small gland in the neck that controls many important functions, including metabolism, energy levels, body temperature, heart rate, and digestion. Thyroid problems become more common as women get older, especially after the age of 50. Unfortunately, the symptoms are often mistaken for normal aging. One of the most common thyroid problems is an underactive thyroid, also called hypothyroidism. When the thyroid does not produce enough hormones, many body functions slow down. A common warning sign is persistent tiredness. A woman may feel exhausted even after getting enough rest and may notice that she does not have the same energy she once had. Unexplained weight gain is another possible sign. Some women may gain weight despite no major changes in their diet or activity level. Feeling unusually cold, having dry skin, thinning hair, brittle nails, constipation, and a slower metabolism can also be symptoms. Thyroid problems can also affect the brain and emotions. Some women experience difficulty concentrating, memory problems, low mood, or feeling mentally foggy. On the other hand, an overactive thyroid can cause different symptoms, such as unexplained weight loss, rapid heartbeat, increased sweating, anxiety, shaking, and trouble sleeping. Because thyroid symptoms can look similar to many other conditions, proper testing is important. A simple blood test can help determine whether the thyroid is working normally. The good news is that thyroid disorders are usually manageable with proper medical care. Many people feel a significant improvement once the condition is correctly diagnosed and treated. Women over 50 should not ignore ongoing changes such as extreme fatigue, unexplained weight changes, hair thinning, mood changes, or unusual sensitivity to temperature. These signs may not simply be a result of aging. Sometimes they are signals from your body that deserve attention. Now let's discuss another health problem that can slowly affect independence and quality of life if it is not detected early. The seventh health problem women over 50 should never ignore is vision problems, including cataracts and glaucoma. Many women notice changes in their eyesight as they get older. While some changes are a normal part of aging, certain eye conditions become much more common after the age of 50 and can seriously affect independence if they are ignored. Two of the most common age-related eye problems are cataracts and glaucoma. Let's start with cataracts. A cataract occurs when the clear lens inside the eye becomes cloudy over time. This makes it harder for light to pass through properly, causing vision to become blurry or less clear. Cataracts usually develop slowly, so many people do not notice the changes in the beginning. However, as they progress, women may experience difficulty reading, driving at night, watching television, or recognizing faces clearly. Common warning signs of cataracts include cloudy vision, increased sensitivity to bright lights, difficulty seeing in low light, seeing halos around lights, and needing brighter lighting for everyday activities. Some people also notice that their glasses prescription changes more frequently than before. Another serious eye condition is glaucoma. Glaucoma damages the optic nerve, which sends visual information from the eye to the brain. In many cases, this damage is related to increased pressure inside the eye. The biggest concern with glaucoma is that it can develop silently. A person may not notice any changes in vision during the early stages, while damage is slowly occurring. Over time, untreated glaucoma can lead to permanent vision loss. Some possible warning signs in advanced stages include loss of side vision, difficulty seeing in darkness, eye pain, redness, blurred vision, or seeing halos around lights. Because glaucoma can progress without obvious symptoms, regular eye examinations become extremely important after the age of 50. Several factors can increase the risk of vision problems. These include age, family history, diabetes, high blood pressure, smoking, and previous eye injuries. Protecting eye health requires more than just wearing glasses. Eating a nutrient-rich diet with leafy green vegetables, colorful fruits, fish rich in omega-3 fatty acids, and other healthy foods can support eye health. Protecting your eyes from excessive sunlight, controlling blood sugar levels, managing blood pressure, and avoiding smoking are also important steps. If you experience sudden vision loss, severe eye pain, flashes of light, or a sudden increase in eye floaters, seek medical attention quickly. Your vision plays an important role in your independence and quality of life. Taking care of your eyes today can help protect your ability to see clearly in the future. The 8th health problem women over 50 should never ignore is vitamin D and vitamin B12 deficiency. Many women experience tiredness, weakness, or changes in energy levels after 50 and assume these symptoms are simply part of aging. However, sometimes these symptoms may be linked to nutritional deficiencies, especially low levels of vitamin D or vitamin B12. Vitamin D is essential for strong bones, muscle function, and immune health. After menopause, women already have an increased risk of bone loss. If vitamin D levels are too low, it can make maintaining strong bones more difficult. One common sign of vitamin D deficiency is ongoing fatigue. Other possible signs include muscle weakness, body aches, bone discomfort, mood changes, and getting sick more frequently. Women who spend little time outdoors, have limited sun exposure, or have certain health conditions may have a higher risk of low vitamin D levels. Vitamin B12 is another important nutrient, especially for older adults. It plays a major role in nerve function, red blood cell production, and maintaining energy levels. A deficiency in vitamin B12 may cause tiredness, weakness, numbness, tingling sensations in the hands or feet, balance problems, memory difficulties, and trouble concentrating. Some women describe feeling mentally foggy or having difficulty focusing on normal daily tasks. If left untreated for a long time, vitamin B12 deficiency can sometimes cause nerve-related problems, which is why early detection is important. The best way to know if you have a deficiency is through appropriate blood testing recommended by a healthcare professional. A balanced diet can help maintain healthy vitamin levels. Vitamin D can be supported through safe sunlight exposure, fatty fish, fortified foods, and supplements when recommended. Vitamin B12 is found in foods such as fish, meat, eggs, dairy products, and fortified foods. However, taking supplements without understanding your actual needs is not always the best approach. It is better to identify a deficiency and follow professional guidance. Remember, constant tiredness, weakness, or changes in concentration should not always be accepted as a normal part of getting older. Sometimes, these symptoms are your body's way of asking for attention. Now let's move on to another important health concern that affects the brain and can influence memory, thinking, and independence over time. The 9th health problem women over 50 should never ignore is memory changes and cognitive decline. As women get older, it is normal to experience some small changes in memory. Forgetting a name occasionally, misplacing keys, or needing a little more time to remember something can happen as part of normal aging. However, there is an important difference between normal age-related changes and memory problems that may indicate a more serious issue. When memory changes begin affecting daily life, relationships, or independence, they should not be ignored. One warning sign is frequently forgetting recently learned information. This may include repeating the same questions, forgetting conversations that happened recently, missing important appointments, or struggling to remember events from the near past. Another sign is difficulty completing familiar tasks. A woman who was previously able to manage daily responsibilities easily may start having trouble organizing finances, preparing familiar meals, managing medications, or following normal routines. Changes in problem solving and decision-making can also be important. Some people may find it harder to plan activities, make choices, or handle situations that previously felt simple. Language changes are another possible warning sign. A person may struggle to find the right words, lose track of conversations, or have difficulty explaining thoughts clearly. Confusion about time and place can also occur. For example, someone may forget where they're going, become confused in familiar locations, or have difficulty remembering dates and events. Changes in personality or mood should also receive attention. Some women may become unusually anxious, withdrawn, suspicious, or lose interest in activities they previously enjoyed. It is important to understand that memory problems do not always mean dementia. Many other factors can affect memory, including stress, poor sleep, vitamin deficiencies, thyroid problems, certain medications, depression, and other treatable conditions. This is why seeking medical advice is important when noticeable changes appear. Protecting brain health starts with taking care of the whole body. Regular physical activity improves blood flow to the brain and supports overall cognitive health. Simple activities like walking, swimming, dancing, or strength exercises can be beneficial. Keeping your brain active is also important. Learning new skills, reading, solving puzzles, playing an instrument, or engaging in meaningful conversations can help keep the mind stimulated. A healthy diet also supports brain function. Foods rich in vegetables, fruits, whole grains, fish, nuts, and healthy fats provide nutrients that support both brain and heart health. Quality sleep is another important factor. Poor sleep over a long period can affect concentration, mood, and memory. Maintaining social connections is equally valuable. Spending time with family, friends, and community groups supports emotional well-being and mental health. If you or someone close to you notices ongoing memory problems, difficulty performing daily tasks, or major personality changes, it is important to discuss these concerns with a healthcare professional. Early evaluation can help identify the cause and provide options for support and treatment. The 10th and final health problem women over 50 should never ignore is gynecological health changes, including ovarian and cervical health concerns. Many women assume that after menopause, reproductive health is no longer something they need to focus on. However, important changes can still occur after the age of 50, and some conditions may develop with very subtle symptoms. One important concern is ovarian cancer. Ovarian cancer can be difficult to detect early because its symptoms are often mild and may be mistaken for digestive issues or normal aging. One possible warning sign is persistent bloating. Occasional bloating is common, but ongoing bloating that does not improve should be discussed with a healthcare professional, especially if it occurs with other symptoms. Other warning signs may include pelvic or abdominal discomfort, feeling full quickly after eating, unexplained weight changes, changes in bowel habits, frequent urination, or unusual fatigue. These symptoms do not always mean cancer, but persistent changes should never be ignored. Another important area is cervical health. Although cervical cancer screening has helped reduce cases significantly, regular medical checkups remain important because early stages may not cause noticeable symptoms. Warning signs that require medical attention include bleeding after menopause, unusual vaginal bleeding, unusual discharge, or persistent pelvic pain. Any bleeding after menopause should always be evaluated because it is not considered a normal part of aging. Protecting gynecological health includes staying up to date with recommended screenings, maintaining a healthy lifestyle, and communicating openly with healthcare providers about any changes. Regular exercise, a balanced diet, maintaining a healthy weight, avoiding smoking, limiting alcohol, and managing stress all support overall health. Remember, getting older does not mean you should ignore changes in your body. Women over 50 deserve attention, prevention, and proper healthcare at every stage of life. Now that we have discussed the 10 health problems women over 50 should never ignore, let's look at the most important message from this video. Aging is a natural part of life, but ignoring your health should never be considered normal. The most important lesson from this video is that your body often gives you signals before a health problem becomes serious. Changes in your energy levels, unexplained weight changes, unusual pain, changes in your vision, memory problems, or any symptom that feels different from your normal experience deserves attention. Many women spend years taking care of their families, careers, and responsibilities, but sometimes forget to prioritize their own health. After the age of 50, regular checkups and preventive care become even more important. Simple steps like monitoring blood pressure, checking blood sugar, maintaining bone health, getting recommended screenings, and discussing unusual symptoms with a healthcare professional can make a major difference. Remember, prevention is not about fear. It is about awareness and making informed decisions. Your heart, bones, brain, eyes, and overall well-being all depend on the choices you make every day. Small healthy habits can create powerful results over time. Eating a balanced diet, staying physically active, getting enough quality sleep, managing stress, maintaining healthy relationships, and following medical advice can help support a longer, healthier, and more independent life. Getting older does not mean losing your strength or quality of life. With knowledge, awareness, and proper care, women can continue to enjoy an active and fulfilling life at every age. If you notice any concerning changes in your health, do not wait and hope they disappear. Listening to your body and seeking professional guidance when needed is one of the most important things you can do for yourself. Your health is your greatest investment. If you found this video helpful, subscribe for more educational content about women's health, healthy aging, nutrition, and wellness. Share this video with your mother, sister, wife, friends, or any woman who may benefit from this information, because awareness today can help create a healthier tomorrow. Stay informed, stay healthy, and take care of yourself.